here for a moment. So first, just a couple of housekeeping items. Please keep your microphones on mute just to ensure that the sound quality is great. If you need anything, I will be monitoring the chat, so feel free to put anything into the chat box. I also recommend that you put your view on speaker view while we will be doing a screen share throughout the presentation. It will be helpful for you all to see Denise as she is speaking. And then lastly, Professor Garcia will be speaking for about 25 minutes, and then there will be time for Q&A at the end. Also during the Q&A, please put your questions into the chat box, and I will read them aloud so that she can answer them. So with that, I am going to hand it over to Nick Beek.
Thank you everyone for joining us today, and especially Professor Garcia for taking the time to speak with alumni and guests. As community leaders, we frequently hear requests from alumni for events for professors who are experts in their field. The silver lining of this pandemic has been virtual events, and we can think more creatively about bringing content like this to alumni from across the nation. Now I'd like to briefly introduce Professor Denise Garcia. Professor Garcia is an associate professor in the Department of Political Science and the International Affairs program at Northeastern University in Boston, and a Nobel Peace Institute fellow in Oslo in 2017. She conducts research on the role of international law in world politics. She's also interested in the questions of robotics and artificial intelligence, global governance of security, and the formation of international norms and their impact on peace and security. In 2016, she testified to the United Nations on the question of lethal autonomous weapons and their impact on peace and security. She is a member of the research board of the Institute for Economics and Peace and of the Institute of Electrical and Electronics Engineers Global Initiative on Ethics of Autonomous and Intelligent Systems. And now I'm excited to hand it over to Professor Garcia.
Thank you so much, Nick. Thank you. I want to thank Northeastern University Office of Alumni Vice President Rick Davis and Stephanie Foner on his team for organizing this timely event. Warmest greetings to alumni and parents attending today, even from London, even though it's quite late there. As we start our event now, the number of global cases of people infected by COVID-19 just surpassed 10 million and 500,000 deaths. This week also marks 6 months since the World Health Organization warned countries about a novel outbreak in Wuhan, China. The pandemic is now 6 months old this week. The coronavirus, the novel coronavirus and its resulting disease, COVID-19, has attained the level of really a world-shattering global pandemic with disastrous, far-reaching consequences for humanity. So how did states first respond? Well, initially, they were caught off guard and unprepared. Most of them, states have turned inwards to locate their individual solutions at the country level. So borders closed, foreign citizens were invited to leave, and nationals traveling abroad were urgently pressed to return. I saw firsthand the extraordinary measures that were put in place to contain the spread of the virus, such as lockdowns, travel restrictions for entire populations. As part of my research sabbatical, I was in Sydney, Australia in March, and was supposed to be there until the end of May, but the Australian Prime Minister announced the imminent closure of borders, and my airline decided to stop flights to and out of Australia. So I changed my plans, rushed to the airport in desperation, found a flight back with another airline, and came back to Boston in one of the last flights outbound from Australia. And all my sabbatical plans, all my other travel plans were disrupted, sadly. Well, despite the insularity of countries' responses, the pandemic has also unleashed exceptional and extraordinary new hopeful forms of global cooperation. Countries closed, locked their borders, and scientists shattered theirs. So let's examine such novel and pioneer forms of global cooperation that are taking place to defeat the virus and could serve as models for other pressing world crises. I see many of my former students here. I may turn to them for these models later on. So, in all honesty, I know that in this current climate of unrest, injustice, tragic uncertainty, it is odd to think positively or to seem hopeful. In my life, especially, from the lessons I learned from my students and alumni in my last 13 years at Northeastern, what I discovered is that to be hopeful takes much more work than being pessimistic. For you to be hopeful, you really must delve deeply and investigate what goes on behind the scenes. Most of what we hear in the news is bad news. Therefore, it's easier in a way to be a well-informed pessimist. You get that everywhere, right? So once more, I experienced this back in March when I came back home to Boston. By reading the news, I would only get the awfully grim picture of the pandemic, the tragedy, the mounting suffering. However, by delving deeper and by understanding what was actually being done to confront the pandemic, I saw another picture as well, one of hope, acts of kindness, philanthropy, scientific discovery, and bravery from human beings all over the world. Inspired, I subscribed to a number of scientific and medical news, some of them hard to read, but most of them so exciting. I became a member of the American Academy for the Advancement of Science. I then submitted a research project for my college, the College of Social Sciences and Humanities, and its brave and timely COVID-19 initiative with colleagues. And then I submitted teaching proposals to my college, to Northeastern, about the transnational network that formed to defeat the pandemic and contain the tragedy and the suffering. To confront what's happening right now in the world, we shall not be either skeptical or celebratory. We have to actually look at what's happening behind the scenes, examining the facts. We cannot fall into these ineffective ideological divisions that either vilify international cooperation, such as the one promoted by the World Health Organization, or defend it. When people talk about international cooperation, my sense is that they often mean agreements among governments, agreements among states, among countries. What I see happening now goes much beyond state-to-state cooperation to defeat the pandemic. There is actually a dearth, a scarcity of state-to-state cooperation right now. There is cooperation between states, but there is more of something else that I want to talk to you about. I see instead a true mosaic of scientists in all areas, philanthropists, businesses, individuals, in many countries as well, coming together to forge networks of collaboration. So let's look at three forms of cooperation to defeat the pandemic that are firmly anchored on the achievement of the global public good. And what is this global public good? What is this common good of humanity? These are, right now, for this situation, that means vaccines and treatments for all, rich and poor. So the first form of cooperation is the scientific cooperation, that really the sciences, the scientists, right? That has sharply outpaced and outshined any other form of cooperation that I'm looking at. The scientific communities here of each country joined hands and combined efforts to intensify the search for common solutions, and paper publication really skyrocketed. With my colleagues in my research project, we are monitoring that, we're tracking that. Scientists around the world are acting really, I would say, in sharp contrast to the insularity of states. So the scientists pioneer a movement, the medical scientists, the other biology scientists, a movement for transboundary information, pre-peer-reviewed, proprietary database sharing that was never really seen before. So they are pushing other priorities aside and they're focused on a common problem: how to treat and prevent this horrible disease. The second form of cooperation that I see is characterized by multiple coalitions across different sectors of society. Public, private, philanthropic, civil society organizations to finance independent research projects, collaboration research projects to develop solutions. So this novel form of cooperation is what I call transnational networked cooperation. This is a term that I coined in my just finished current book project on autonomous weapons and artificial intelligence, or killer robots as they are called. So let me give you a few examples, 2 new examples that were for confront this tragedy, this pandemic, and 2 that were already in existence but are now very powerful platforms to defeat the pandemic. So the first example here of transnational networked action and cooperation is what's called COVID Plasma Alliance. And COVID is a reference to COVID-19 and hyperimmune globulin, which is the medicine generated from the plasma that is extracted from the blood that has been pooled and processed to concentrate the most powerful antibodies to develop a treatment made from the antibodies. So the goal of the alliance is to develop treatments made from these antibodies of people who already contracted the virus. So the top plasma derived therapy companies here in the world form part of this alliance: Takeda, CSL Behring, Biotest, etc. These companies were first trying to develop the treatments to an extent on their own, trying to get ahead and try to find solutions, but they realized it was better to cooperate and come together, to work together. The second example here is the Therapeutics Accelerator, also a novel form of cooperation that is happening, created in March. And their motto is very interesting and it will resonate with you. So they say, no one is safe until everyone is safe. So the global economy is losing about $400 billion every month. So the accelerator was launched by the World Health Organization, by the Bill and Melinda Gates Foundation, by France, by the European Union. So since this collaborative endeavor has been working to find the delivery of effective and equitable distribution of therapies across the world, not only for the rich. So once the vaccine is developed, it will need to be distributed, and it will have to be in an equitable way. So this is the goal here. So several scientific networks, foundations, civil society organizations such as the Global Fund in Geneva, and UN agencies such as the World Bank are involved to this end, and they formed something called the Health Systems Connector to ensure that every individual in the world will benefit from the discovery. So this cross-cutting collaboration here is really extraordinary, I would say, and it takes place with the biotech, the pharmaceutical industries as key partners. The other instance here is the Gavi, that's the Vaccine Alliance. Gavi is going to be 20 years old. It's 20 years old already. It's a international organization in Geneva, Switzerland, where most of all these international humanitarian action takes place. It's a public-private global partnership with the goal of increasing access to immunization in poor countries. The last example here, dear friends, is the Coalition for Epidemic Preparedness Innovation, CEPI. That was launched at Davos, the World Economic Forum, in 2017. And I have here in the audience many people who were with me at the World Economic Forum in Geneva last summer. And here, CEPI, the Coalition for Epidemic Preparedness Innovations, really was created out of a need to develop and deploy vaccines to prevent future epidemics. So it was created right on time for us to be able to confront the challenge we're living through. CEPI was created by Germany, Japan, Norway, by the Gates Foundation and other civil society organizations as well. And now, since the pandemic started, more countries have joined the European Union in its full force, Canada, United Kingdom, Australia, etc. So the third form of cooperation is of an international type, one that people would more often associate with cooperation. So this is the one that you would think, oh, that's cooperation happening. So this is the one that I want to mention. Examples here for you is the one carried out by the World Health Organization, with a particular focus here on what is called the solidarity trials. And then also I want to mention the cooperation that is happening within the European Union with other countries around the world. So very briefly on the solidarity trials, this is fantastic. This is an incredible instance of cooperation. So this was launched by the World Health Organization in March, and partners to sponsor just a giant trial. So the trial of new drugs is very complex, it's very complicated, and testing of the potential new therapies, old medicines and new medicines in conjunction sometimes. So here, the World Health Organization does the coordinating role, right? Putting the data and the scientists together. So the other instance here of cooperation in this area is what happened in May in Geneva. Well, actually this year it happened online for the first time. The World Health Organization had its Health Assembly, which is this convening body for the World Health Organization, online for the first time in its history. And it always happens in May and June in Geneva. And it's always when I'm there with my students as I lead this annual program, and I have many alumni from this program here in the audience, and some of my team leadership members here as well. And we're always inundated with WHO events, and we were invited to some last time when we were there in July. So this time, this historic gathering happened online. And on May 14, actually, 140 leaders gathered for the World Health Assembly of the World Health Organization decided on something called the People's Vaccine. So this was quite historic. This was a historic call for a people's vaccine. This call for a vaccine that is for everybody, for all peoples, represents, I would say, the most ambitious joint position to date. And it demands that vaccines are available for each human being, free of charge. Countries are working towards that now. They're mounting other pledges, but this meeting at the WHO online was perhaps one of the most important meetings in terms of international cooperation of the architects of who are building a better future, common future for humanity after the pandemic. I want to mention as well the leadership from the European Union, because it never makes the headlines, you know. We only hear when the United States is walking out of international cooperation, but we don't really hear a lot about how the EU is positioning itself. So the EU, as you know, is one of the largest economies in the world. By some accounts, is the largest economy in the world. It's 27 members. And it organized on May 4th, the first meeting, invited leaders, experts, scientists, celebrities to create a joint pledge platform to raise money for the vaccine that would be universally available. So at the end of this first iteration, $10 billion were raised. The EU admittedly came a little late, perhaps, in this fight to defeat the pandemic, but it is coming through quite strongly now. So this first meeting, the US, the United States of America, did not attend this meeting, I'm afraid. But countries beyond the EU did so, including Norway, Australia, Japan, the United Kingdom, Saudi Arabia, Canada, and others participated and contributed efforts. Just this weekend, I don't know if you've seen, but there was something called the Global Go, Unite for the Future. Have you seen that? So that was a pledging summit that took place, organized by the European Union President Ursula von der Leyen, one of the emerging leaders in this. I would say she is the president of the European Commission, which is the executive arm of the European Union. It was organized by the European Union, by Global Citizen, and by the European Investment Bank to safeguard what the European Union is called, and you're going to be very inspired right now, vaccine multilateralism. So vaccine multilateralism. That is for guaranteed vaccines for all. There was a concert associated with it. Some of my favorite artists there, Angelique Kidjo and many others. And the concert is in Spotify right now. I spent the last 2 days just listening to it. So Global Go, Unite for the Future. You can see the concert on Spotify. Billions of euros were pledged in these last days. So now I want to answer some important questions here that were proposed to me by the brilliant Stephanie Foner from the Alumni office, so to guide me in my expose. So the first question is the organization, systems in place to defeat the pandemic. What are they doing? So first of all, of course, the World Health Organization, but in partnership with Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovation. So this cooperation is essential. They are aiming to speed the research and development process for all countries and simultaneously, that's key, establish the manufacturing and the distribution infrastructure for the vaccine. Because once the vaccine is out, you gotta distribute it for billions of people around the world, and most people in the world live in regions where there are no railways, there's no roads proper, established. So imagine the difficulty of distributing the vaccine. So that's the goal here. So the aim is to deliver 2 billion COVID-19 vaccine doses by the end of 2021 for the countries with the greatest needs. The second structure in place is, of course, the Gates Foundation. So they act like a science connector, bridge builder, making action take places across borders with just the most incredible generosity. Whenever I feel, it's been very, very heartbreaking for me, to cancel all my plans. I had organized this sabbatical for the last 3 years, and, it's just very sad. But whenever I feel that I need to put what's happening into perspective, and the tragedy, to understand the tragedy that is happening in the world right now, I read The Optimist, which is the Foundation's magazine, the Gates Foundation's magazine, The Optimist. Or I just listen to Bill Gates, his interviews on CNN or his TED Talks, The other structure that is in place is the World Health Organization. So first, let's be clear about what the World Health Organization is and what is not. So I think this clarity would help a lot of people, especially in our highest offices in our country. So the World Health Organization is a forum, a convening body. So it's the most important technical resource for humanity in public health. So it's not a regulator, though. It's not a global police for public health. It has a role of a convener. So it gathers its 194 member countries in Geneva every year, as I told you, at the World Health Assembly. In this World Health Assembly, it's this decision body, right? And in 2005, there was a very historic moment where the World Health Organization Assembly decided upon an international treaty called the International Health Regulations. And that's where countries decided to work together for forging a path towards global health security by building their capacities to detect, determine, notify, report any new or ongoing public health events. So these regulations represent the basic international law, and they're legally binding upon states, and includes, for example, what states have to do when they see a new virus. What's happening here? How do they notify? What are the measures that have to be put in place on their borders, in airports, ports, etc., right? The other structure that is in place is indeed the Med Archive. So Med Archive, that's instrumental. This is an open, cooperative, shared database. The first post on the pandemic was in late January. Just as an example for you to understand the value of this open, shared medical science archive is the genome of the virus was published here too. And it was published just after 2 months. So compare it with the HIV/AIDS genome sequence was just published after 2 years. So scientists here, when they use the Med Archive and what they are doing to confront the pandemic, just tells us that they are not letting any considerations like profit, status, prestige of publishing first in the most prestigious journal to stop progress in the search for a cure. So the second question that Stephanie proposed to me is that how have organizations adapted in, given the urgent need for solutions and research into the disease? So, well, there are 140 vaccine candidates. That's a sign, right? And the best way to track is what's happening in vaccines is to look at the New York Times vaccine tracker. So there you can see they update it every couple days, what's happening with the vaccines. Many pharmaceuticals and labs, they have readapted their research in pursuit of researching COVID. Pharmaceuticals have worked to contract the timeline to produce the vaccine, and this is really a Herculean, colossal effort for many. The forecast of producing a vaccine in 1 year is overly optimistic, right? So therapeutics from antivirals and antibody combinations to drugs will probably be a bridge that will help humanity before a vaccine is in place on the market. So the pandemic has generated extraordinary and never seen before public-private partnerships. So hopefully public-private partnerships is the way forward to the United Nations in general as well. So the third question is, what's the role of the United Nations? So again, let's briefly understand what the United Nations is. The United Nations is an intergovernmental organization. It's a forum where countries meet and take action. So blaming the UN for a lack of action on certain areas to an extent is like blaming Fenway Park for a defeat suffered by the Red Sox. Okay, so let me give you examples where the UN action has been encouraging because of structures that were already in place that do not require the consent of states to go forward. So one example of UN action right now that, again, it's never on any news sources, supplying food for conflict in poverty-stricken areas of the world right now. So right now we have poverty and people who are hungry because of the pandemic here in this country, the wealthiest country in the world. Imagine the situation in countries like Yemen, Libya, and Syria, just to name 3, that have been going through conflict for years now, and these conflicts have shattered have made their public health systems collapse. So the most horrifying conflicts, right? So the UN is there providing food. The other example is the UN Global Compact, which is the world's largest corporate initiative and now turning 20 years old. So this global compact by the United Nations is calling business leaders, is a forum for business leaders across the world to support vulnerable communities right now, and to do so with an eye for a greener future. How are we going to readjust our economy after this? We cannot go back to normal. We cannot go back to where we were. That would be just a waste of an opportunity, and it would be obviously defeating. So a coordinated international business plan will be decisive to bring a speedier economic recovery to the world and create jobs along the way based upon equality and human rights and sustainability. The other example of UN action is the United Nations Secretary General's leadership. So the Secretary General is, his role also has to be understood. He is a mediator. He's the chief mediator for international relations. He goes around behind the scenes trying to do the best he can to convince countries to do this and that. But his role, Secretary General Antonio Guterres, has been extremely remarkable. He has gone over his job duty, I would say. From the beginning, he called on a number of important initiatives. For example, a global ceasefire in all these conflicts that are happening. And very much on the onset of the crisis, he called for the establishment of a fund, a humanitarian fund for the most vulnerable countries. So the other question is, what are the major successes and challenges, right? Well, I think I told you some of the successes already, but the challenges here are enormous as well. So, the COVID-19 pandemic has really demonstrated the interconnected nature of our world, right? So the way I view, as I was thinking about this event, this very timely event organized by our Northeastern University Alumni Office, I thought about a major challenge that has a twofold nature. On one hand, countries are not cooperating sufficiently. As you just heard me, there's a lot of cooperation happening in other spheres of world society. Last week, the United Nations Secretary General, Antonio Guterres, has criticized countries' total lack of coordination in tackling the pandemic. So he said the go-it-alone policies do not work for a global problem of this magnitude. This lack of coordination is what is delaying the global political solution to the pandemic. And here I would say it was striking. I'll comment more in the Q&A part. On the other hand, certain key democracies do not have a concerted, federally executed common policy to protect their populations and slow the virus contagion. So these same countries' governments are not aligning themselves with the current international efforts either, the ones that I just described to you. The examples here of these countries, you can imagine, are my two countries of nationality, Brazil and the United States, where the governments are not aligning themselves with the rest. The successes are many, ladies and gentlemen. It's the number of vaccine trials. It's unprecedented. We can talk about later about what's making it possible for a vaccine to be developed in such an expedited timeline, but it has a lot to do with the development of new technologies as well, including artificial intelligence. Finally, reasons to be optimistic. Well, I think I see a few, actually many, but Gavi, the Vaccine Alliance, already signed a deal to manufacture and distribute doses of the Oxford vaccine, that is one of the most promising vaccines, the Oxford vaccine, by the end of 2020, and agreed to a licensing deal to produce billions of doses, 1 billion doses to low and middle income countries. And the goal is to get to 2 billion doses of the vaccine per year after 2021. So it's very encouraging. The Secretary General of the UN, he sees what he calls an enormous movement of solidarity everywhere in the world that is beyond states, right? Beyond countries' actions. So this movement is about the people's vaccine I told you about that will benefit all humanity. People around the world are showing acts of humanity, inspiring hope for a better future, as we see every day. I will end with this. 2 years ago, the climate scientists published a seminal report, a little frightening, with a big admonition. They said humanity only had 10 years left to contain and revert the most dramatically horrible effects of climate change on our planet. Well, we have 8 years left. So let us take this chance to rebuild the world's economies in a sustainable way and create millions of desperately needed jobs along the way. I would say humanity is tied together here in this endeavor. The global economic recovery is inextricably intertwined with an equitable access to a healthy future. But what I think comforts me is that what I see is that for the very first time, humanity is resolutely absorbed in finding solutions, united by one collective endeavor. The enormity of this crisis and shared threat summon the need for coordinated action across borders. So thank you so much. Thank you very much.
Thank you so much, Professor Garcia. I am excited to open up the floor for questions. We actually have one in the chat already. I do also want to highlight that Professor Garcia is just at the outset of this really exciting opportunity for research. So in many ways, we're advancing as we go. And if anyone has any questions on her other areas of expertise, the UN, global cooperation, artificial intelligence, please feel free to ask those as well. So please, again, put your questions in the chat box and I will be happy to read them out loud. The first question that we have is, how do we protect citizens from biopharmaceutical companies who may exploit the pandemic as an opportunity to generate revenue? Do countries have the responsibility to protect their residents from this?
Yes, absolutely, right? So that's obviously, it's a major concern. I believe right now, the pharmaceutical companies, as I see, are having a comeback, a chance to shine brighter than they ever had. So if they seize this moment to do something that is good for humanity right now, for the common public good, I think the wounds of the past will be healed, hopefully. So I see this moment as an opportunity for the pharmaceuticals as well to make good. And what I believe as well is that now everything is in the open. You know, everything is so public, especially vis-a-vis the pandemic and this ongoing movement as well to end racism and inequality. So it would be, I think, quite hard for any pharmaceutical to exploit this moment in a way that is not positive.
Thank you. Our next question is, how can international coordination react to countries which have covered up the scale of their outbreaks? For where the data is not made readily available by those countries.
Right. So, so if I understand this question correctly, which is a great question, is that indeed there was a moment, many days that that the Chinese government has attempted to cover what was happening in Wuhan, and this has been disheartening. However, I believe that after that, and from the beginning, actually, the Chinese scientific community, the scientists, have been very, very present. And a lot of the research that has opened paths and avenues for other research to defeat COVID-19 were generated by Chinese scientists in partnership with many other scientists all over the world. So this is heartening for me. So we have to separate, I'm afraid, the actions of the government of China and the scientists in China. It's very important that we do so. The Chinese scientists worked day after day to publish the genome sequence of the virus, and that was very laudable. But indeed, right now, as we speak, the new blueprint for reinforcing the international legal framework for public health is being built. So reinforcing what we have is going to be key for these cover-ups not to occur again. Because we, as you know, a week, 2 weeks in this pandemic are essential. We can say that in the United States, we lost about almost 2 months of actual. 2 months could have saved quite a number of people. Yeah.
Okay. How do you weigh the advantage of tracking technology? So that's the contact tracing technology using geolocations with privacy and surveillance concerns during the global pandemic?
Yes, one of my favorite engineers is here in the audience. I don't want to put her on the spot, but she knows much better than I. She just graduated from our computer engineering college and was the commencement speaker for the class of 2019. So this is the area, ladies and gentlemen, that I know the least right now, because I have this former student, so I count on her. But it's a lot about tapping into artificial intelligence, computational techniques. As you know, artificial intelligence is an umbrella concept involving, including many computational techniques such as machine learning that has gained a lot of attention, and it's a credit the success of artificial intelligence recently. So we're going to need to tap into these rising technologies to be able to do an effective tracking operation across the world. I know that here in Massachusetts, for example, we are on track to do that, to be able to do that. The former president of the World Bank, Dr. Kim, who was a speaker for Northeastern commencement speaker many years ago, he's leading that with a number of other very impressive people.
Thank you. Do you think that the current mobilization of the scientific community around this current crisis, the COVID-19 pandemic, will be applied to future global crises such as the climate crisis?
Yes.
And leverage these partnerships for the future?
Yes, so indeed, that will happen inevitably. So, in the climate change area, you have the Intergovernmental Panel on Climate Change, the IPCC, that won the Nobel Peace Prize in 2007. So the climate change area of study and action, of global action, already has an established group of scientists that are who are very vocal and who are very crucial, instrumental in generating knowledge and really instructing governments in this very technical, complicated area that is climate, right? So for the future, what will happen is, of course, we're going to need, for the climate, we're going to need more inclusion. That means more private source, private funding, private public partnerships, and the input of the scientists and this transnational networked cooperation will have to be center stage. So that's what I'm anticipating, and we'll see that in the next summit, the climate summit. As you know, for those of you who probably don't know, but as Northeastern University has access to the annual climate summits. This is something that I have requested, and I had great assistance from President Aoun's office back in 2008 for us to get accreditation for the climate summits participation every year. As you know, this year the summit was postponed for 2021, and we will be able to be there live to see how that will unfold as Northeastern University.
You spoke earlier in your presentation about countries that are choosing to go at it on their own rather than collaborating. What are the potential harms of individual action rather than cooperation?
So here, ladies and gentlemen, I would say it's very harmful. In going it alone, if you want to see how bad it can go, just look at our own country right now. Right? But I think this is a very critical moment for humanity, right? And every day, you know, as this tragedy of going it alone and putting whatever countries first is happening, every day we're inspired by these people who are never thinking about themselves first, right? These frontline workers, healthcare givers, you know, medical professionals, in our country here in the United States, mayors and governors who stepped in and with great valor, humility, and bravery, right? But it's very important for us now to contrast, for answering this question, this is such an interesting, important question, is to look at the world leaders of the moment. Who are the world leaders of countries that did not go it alone? So I think I can mention a couple of examples just to inspire us at this moment, really, where we are craving for inspiring leadership. So the Prime Minister of New Zealand, Jacinda Ardern, is one example. This is the third but youngest woman in the High Office of New Zealand, the first woman who had a child during her term. Her message was very clear and sobering, yet soothing and unifying. Her country was the first to firmly act, I would say, and they stopped the community transmission of the virus. But the second example I want to bring to you for us to contrast action is Chancellor Angela Merkel of Germany. And this is a country that took care of its problem and is leading the European Union with other countries in the European Union. It's the opposite of go it alone, right? So, and putting her own one country's first. So as a scientist, Chancellor Merkel, really, we saw her transforming to be the commander-in-chief to be the scientist-in-chief, right? The few times she had addressed her nation, she exuded that calm, that confidence, the rigor of a former research scientist herself with a doctorate in quantum chemistry, right? So, and she's also a brilliant mathematician, so she knows what she's doing and how can explain the numbers in a way that millions can understand. So this is, I think, the examples I wanted to bring to really fully answer this interesting question.
So we have two more questions. The first is, with so many competing needs in different programs, how should we think about prioritizing funding? There's revitalizing economies, there's the scientific engagement. How should we be prioritizing the funding to address all of these issues?
I think putting people first, putting humanity first and the public health needs first. And then we have to align this prioritization with a new future. We cannot go back to normal. We can't crave to go back. That normal is not going to work for humanity anymore. We're going to have to work for a future that is sustainable and includes everybody, that includes all people in all countries. So that's, I think, the priority. In my life as a professor at Northeastern, I always think the students come first. That's my priority. And then with that, I bring my research in. So I think, I think at this moment, in saving the proportions of course, but for countries, putting people first would be ideal.
And then lastly, is there anything we can do as individuals or on a local level to support these international initiatives and efforts?
Yes, this is extremely important right now. So I would say start by listening to the Spotify list, the concerts that happened this weekend. Connect to these people who, with the European Union, but the global citizens, the organizations the non-governmental organizations that put this together. I think we can definitely do that. And right now, we have to understand that we have to do our best. We have to try to help everyone we can every day. And I think, obviously, being aware of all the goodness that is happening and participate in any organization you can is very important. And of course, voting for people who are science-minded and people who are curious and who can think globally is also, I think, quite important right now.
Thank you so much. And thank you so much for this wonderful presentation, Professor Garcia. I am now going to turn the floor over to Joe Lillis, who is our other volunteer leader in Washington, D.C., to give us a few words about the importance of community and to close us out.
Okay, thank you. As Stephanie said, my name is Joe Lillis. I'm from the class of 1993, and I live here in Washington, D.C. And first and foremost, I want to thank you, Professor Garcia, for a wonderful presentation on such a timely topic that we're all dealing with now. And then also thank you to the Alumni Relations Office to put on a type of event like this. As Nick said earlier, in the beginning, it's one of the, I guess, I don't know if you can call it positive of this, is that we've all kind of come together with Zoom technology and some of these other avenues to be able to socialize and network and learn from each other. And that's something, as Nick said, is that a lot of people have asked for over the years in alumni relation offices, alumni chapters, that we would have professors speak to us about some incredible topics. And so these avenues allow us to kind of do that, have these professors speak to us. I wanted to kind of talk about what we do here in the DC alumni chapter, but then other chapters throughout the country. I think a lot of people, alumni, parents, don't realize how many chapters we have and then how many people we have in chapters. We have over 40 different chapters throughout the United States, throughout the country. And just speaking for the DC alumni chapter alone, we have about 4,000 alums in this greater DC area. And we have chapters, as I said, throughout the country, major cities and such, that it's a great kind of gathering for everyone to kind of come together. As I said, I can speak for the DC chapter. We put on about 12 events a year, so about one a month. And with that, we average about 25 to 50 alums to come to these events. And we have events, we break them down really in two areas: social events, which might be kind of happy hours or kind of sporting events. A lot of times when the Boston teams come down to the DC area to play the DC teams, we'll have an alumni gathering beforehand at a restaurant and then go to the sporting event. The other kind of subset that we do are a number of educational events. So we'll have professors speak to us about particular topics. We'll have tours, behind the scene tours of a number of the museums that we have here in DC. So we try to incorporate those type 2 events, social events and educational events. And then I think one of the best things that I find out of coming with an alumni chapter, and that's what I kind of encourage some people to do, to not only join it for the social events, the educational events, but the networking events. And in my situation, from someone who's graduated over 25 years ago, I find now I'm in a role where I'm a mentor. And just the years that I've been here, I've provided a lot of advice to young alums that are moving to the DC area. I've helped a number of them get or obtain their first jobs. I work on Capitol Hill, and I've helped a number of them get jobs on Capitol Hill, think tanks, some organizations here in the Washington, D.C. area. I've helped a number of co-ops, and I just find so much joy out of that. And or just even the most simplest thing, when a young alum moves here or a co-op moves to the D.C. area, they just ask me advice on what's a great restaurant to go to. So it's one of those things that we as alums can do, is to be able to provide advice to some of those younger alums who move to a new city or don't have that many friends or not aware of so many things, that we could be that outlet for them and provide that guidance. So, and you know, as I said, I'm speaking for DC chapter, but all the chapters throughout the country and throughout the world, there's many people like myself and Nick and others that provide a lot of these particulars for these co-ops and alums that are moving into their area. So, you know, as I said, I've been doing it for about 20 plus years, and I've enjoyed every single minute of it being an active alum. So I encourage others to get involved in their local their local community wherever they live. So thank you so much for this opportunity.
Thanks so much, Joe. And thank you all. I hope you have a great evening. Thank you for joining us.
Thanks.